24 million people in the United States have diabetes. It is a staggering number, and because this is American Diabetes Month, we wanted to learn more about this disease and why that number is so high. Dr. Mark Hippensteel from Patient First joined us once again this morning. Happy to have a break from talking about swine flu.
Yeah, for a change. Yes,
to address
nice.
something else that's very serious.
Good old-fashioned diabetes.
Yeah, something that's not seasonal, not going to come and go,
Absolutely.
and not something that you can get a vaccine for.
Right, that's right. Diabetes, I tell you, what is diabetes? Diabetes is essentially the body's inability to utilize glucose as a source of energy. It all revolves around insulin. Insulin is the hormone that the body needs to use glucose from the bloodstream into the cells. And there's basically two types of diabetes, type 1 and type 2. This has changed over the years as far as the categorization, but essentially type 1 is the patients who do not make any insulin at all. These are the patients who get ill very young, a very high genetic component to those type of patients.
Type 1 was referred to as juvenile diabetes,
exactly,
right? Okay.
And juvenile onset. Those patients make up about 10% of the diabetic population. The other 90% is type 2 diabetes, and that is essentially when the patients make very little or not enough insulin, or their body is resistant to the insulin that they're making. Where
does weight factor in with diabetes? Because I know some of those numbers are on the rise. It's at least been attributed somewhat to childhood obesity and just how obesity is on the rise at every age.
Right. Weight is known to be a factor in primarily in type 2 diabetes. The heavier patients get, the more resistance they get to insulin. So that is a big component, and we all know that it seems that as you get older, you tend to put on more weight and will tend to develop diabetes a lot.
So the weight can cause diabetes, not just complicate it. It can actually cause it.
Absolutely, yeah, no doubt about it. And that's one of the big factors in treating diabetes is telling patients you have to change your lifestyle, lose that weight, and a lot of times patients will be able to minimize their medications or possibly get off their medications altogether.
There's some good news there if folks are able to lose the weight. Give us some more good news about diabetes. You know, for those folks who are, for folks who are born with it,
right.
Who cannot, change their lifestyle and be rid of this disease. The testing is painful, it's tedious, the injections. Now, is any of that getting easier with technology?
It really has. I mean, even since I've been to medical school, it's just like a quantum leap in the medicines that they've come out with. It's much easier to treat, and essentially, nowadays it's pretty much taking a pill a day or two, to really control their diabetes. And that's, to me, that's the hardest thing. If they could come up with a cure for patients not taking their medicines, that would be the biggest cure of all. But that is as simple as that for a lot of these cases.
Well, there is some good news that it is manageable. Thanks again, Dr. Mark Hippensteel. If you have more questions, one of the 8 Patient First locations in Hampton Roads will help you 365 days a year from 8 in the morning until 10 o'clock. Your top local